Should I get a brow lift to make my eyes look more open?
The appearance of your eyes, regardless of your age, can be the key to how you are perceived by everyone who interacts with you. A lot of people who want to improve the appearance of their eyes look in the mirror and raise their eyebrows using their forehead muscles as well as their fingers to lift their eyebrows. Based on these actions, it's understandable to believe that a brow lift procedure can be the key to enhancing the appearance of your eyes. I'll discuss how I advise my patients about the benefits and the downsides of brow lift surgery. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in the New York City and Long Island area for over 25 years. I perform several different types of surgical brow lifts as standalone procedures. I also often combine brow lift surgery with cosmetic eyelid surgery and facelift surgery. I perform different types of non-surgical brow lifts in addition using neurotoxins like Botox, Dysport, Xeomin, and Jeuveau. In addition to neurotoxins, I also use hyaluronic acid fillers to provide brow support and elevation as part of a non-surgical brow lifting strategy. I'm well known for performing cosmetic eyelid surgery as well as specialized procedures not typically performed by general plastic surgeons, such as eyelid ptosis surgery, eyelid retraction repair, and revision eyelid surgery for complications after procedures were originally performed by other doctors. When considering surgery for the eyebrows, it is often underappreciated how much the eyebrows contribute to your facial expression. For example, your eyebrows may not be an area of focus, but as soon as they are trimmed, shaved, or if you have microblading done, they become a more prominent facial feature, not always in a good way. This means that any change in your eyebrows can have a significant impact on your facial appearance or expression. The shape of your eyebrows can convey anger, sadness, and surprise with the slightest alteration. So with this understood, any cosmetic procedure that may alter the brow height and shape needs to be carefully planned with the expected outcome to be as predictable as can be. It is generally understood that brow lifting surgery can result in you having a stereotypical plastic appearance. In entertainment, these excessively arched eyebrows or overly tight faces have essentially become a meme. There are several surgical options for brow lifting and brow shaping. As is for any cosmetic concern, we need to be clear about the diagnosis of the problem before defining the solution. I perform surgical brow lifts when the brows have descended or drooped. This is referred to as eyebrow ptosis. Ptosis means drooping, and the eyebrows can descend and have a negative impact on the appearance of your eyes. My approach to eyebrow lifting is to subtly reshape the brows so they frame the eyes in a way which is proportional and harmonious and look natural. In my practice of over 25 years, I have performed a full range of eyebrow lifting procedures. These include coronal brow lift, endoscopic brow lift, hairline trichophytic brow lift, temporal brow lift, and direct eyebrow trichophytic brow lift. I recognized many years ago that, like fashion, there are trends in the aesthetic field. In the 80s and 90s, high and arched brows for women was considered the ideal in the aesthetic field. I found myself at that time questioning this aesthetic since many people were getting brow lift surgery for brows which had not drooped. I have a different perception, and my approach then and to this day is to restore or shape the brow rather than doing a generic brow lift. As mentioned earlier, I perform a lot of non-surgical brow lift procedures to not only lift the brows, but to address a limited amount of skin excess over the eyes. Botulinum toxin can be strategically placed to elevate the eyebrow by several millimeters. The way it works is by relaxing the forehead depressor muscles, such as the procerus, corrugator, and orbicularis oculi muscles. This group of muscles pull the eyebrows downward. So by relaxing the depressor muscles, the muscles that lift the brows, called the frontalis muscle, works unopposed. This effect can last as long as 6 months, but patients usually come in at 4 months so that before the effect completely wears off. Brows can also droop due to volume loss caused by bone and soft tissue deficiency. This can be seen where the temples actually become more hollow that occurs with aging. I place a long-lasting hyaluronic acid filler at the bone level to restore support and therefore elevate the eyebrows. This strategy can be part of a structural volume correction of other areas, such as the cheekbones, jawline, and chin. One of the techniques I frequently use for brow lifting, or as I prefer to define it, as eyebrow shaping, has been more accurate and predictable in my hands. As stated earlier, the eyebrows often droop and descend due to loss of bone volume caused by aging. I create a design and I place the incisions in a way that creates a natural shape. I also perform the procedure in a way to allow the eyebrow hairs to actually grow through the incision, which is called a trichophytic incision. I further improve the appearance of the surgical area by using advanced wound healing material like extracellular matrix by ACell and platelet-rich plasma, also called PRP. Another benefit is that the use of extracellular matrix and PRP can also help thicken eyebrow hair that has been thinning. Eyebrow hair thinning is often associated with aging. I've been using extracellular matrix and PRP for the non-surgical treatment of genetic pattern hair loss for men and women, and we call that trichostem hair regeneration, which I developed starting in 2011. Men and women with genetic and hormone-related hair loss have come to us from around the world to our offices in New York, Long Island, and Northern Virginia. When your eyes look hooded without the presence of eyebrow ptosis, I recommend cosmetic upper eyelid surgery. Cosmetic eyelid surgery can open up the eyes by addressing excess skin or redundant eyelid skin, soft tissue, and fat. When performed artistically and with the right amount of contouring and removal of skin, fat, and soft tissue, it's remarkable how cosmetic eyelid surgery can brighten the whole face. Since I design and perform cosmetic eyelid surgery to maintain facial character, you look like yourself. My patients often report how their friends and families recognize that they look better. They just can't figure out why. I address concerns about potential risks by explaining that expertise and experience is the way to reduce risk in any endeavor, whether it's flying a plane or performing delicate eyelid surgery. Expertise and experience is critical to reach a level where you can be artistic. If you were to play the piano, your ability to compose is dependent on your mastery of piano skills. For example, in eyelid surgery, I designed the skin removal and the eyelid crease by factoring in the skin quality and elasticity the way a sculptor understands the material they're working with, so that any sign of surgery is barely, if at all, perceptible. I perform both eyebrow lifting and eyelid surgery using local anesthesia with light IV sedation and completely avoid general anesthesia. If you have general anesthesia, you have to be paralyzed and rely on a respirator to breathe for you. Many people after general anesthesia experience nausea and vomiting, as well as need an overnight stay at a facility before they're able to return home. In comparison with what we do with local anesthesia and light IV sedation, my patients are comfortable during surgery and breathing on their own, and they go home in about 2 hours after surgery smiling and thanking my staff. The eyes are so important for all types of interaction. The aggressive retailing in the aesthetic field creates a false equivalency in the marketplace, which has harmed countless people, particularly those who are trying to save money. This area is so critically important for both your appearance and your vision. I cannot stress enough the value of a proper consultation so you understand if eyebrow surgery is appropriate for your situation. I hope you found this information helpful. Thank you for your question.